All right, so my presentation is on the cardiac system. So some of the diseases involved in the system would include coronary heart disease, hypertension, rheumatic heart fever, bacterial endocarditis, and congenital heart disease. It's important to touch up on because nearly 65 million Americans are affected by cardiac disease. Nearly 1 in every 4 deaths is related to cardiac disease, and almost every 45 seconds someone experiences a heart attack. So some key risk factors for cardiac disease would include high levels of LDL, cholesterol, physical inactivity, hypertension, diabetes, being overweight, poor diet, alcohol intake, and smoking. So when we talk about coronary heart disease, we're talking about something like an MI where there's a lack of blood supply to the heart, and this is the leading cause of deaths. Arterial cardiovascular disease, nearly 44%. When we talk about systemic arterial hypertension, this is a major risk factor for coronary artery disease. As we know, the higher the systolic or diastolic pressures, there's a greater incidence of mortality and morbidity, and is one of the prime causes of congestive heart failure and strokes. When we talk about rheumatic heart disease, that is related to permanent damage to the heart valves. This usually occurs in patients younger than 25, and it is mostly occurs following a rheumatic fever. When we talk about bacterial endocarditis, it is becoming a severe problem despite the implementations of antibiotic therapies. And it's on the increasing rates are primarily due to the increased use of intravenous street drugs. And it becomes a serious problem because this persistent bacteria is able to spread to the brain, myocardium, spleen, kidneys, as well as other sites of the body. Then we could talk about also congenital heart disease. Nearly 5 per 1,000 live births are affected by congenital heart disease. And we also have metabolic syndrome, which is also known as insulin resistance syndrome, which is a combination of risk factors that places a patient at increased risk for both CVD and diabetes. For review of systems, we're going to talk about through some of the symptoms, such as chest pain, which is one of the most important causes of symptoms of cardiac disease. So it's important to ask, where's the pain? How long have you had the pain? What is the pain associated with shortness of breath? We also have angina, which is a true symptom of coronary heart disease. Patient may describe the pain by clenching a fist and placing it over the sternum. We have palpitations, which is the uncomfortable sensations in the chest associated with a range of arrhythmias. With dyspnea, so complaining of shortness of breath, they feel like they can't get enough air. Syncope, fainting, loss of consciousness. We want to make sure what were they doing before that happened. Fatigue, which is related to the decreased cardiac output. Some swelling of the legs, also known as the dependent edema, which is a frequent complaint. And then we have hemoptysis, coughing up blood, and cyanosis, which only primarily occurs in the lower extremities. Thank you.